Central Valley Today.
Well, as the years go by, we are all bound to notice signs of facial aging, fine lines around the eyes, neck, or jawline. Well, Dr. Dennis Das, a board-certified plastic surgeon in Beverly Hills, specializes in facelifts with a natural look for patients of all ages, and he joins us now with how he addresses the effects of aging that happen in our 40s and 50s and beyond. So, Dr. Das, thanks for being with us again. What are the first signs of facial aging that most people see?
Hi, Emily. Thanks again for having me back. So yeah, with facial aging, there's really two main components that we see. First, we get an reduction in skin elasticity, and that's what causes the skin to sag and droop. And on top of that, we have loss of volume, meaning we lose facial fat in our face, and that makes the situation even worse. So everything kind of falls and sags even more. Now, there's two areas where we typically start to see the signs of facial aging, and that is the eyes and also the neck and jawline.
Yes, I, in my 30s, have that. That's where I saw the aging the very first was around my eyes. And now, you know, as I get into my mid-30s, I definitely sort of see it here. But we've got some photos here. So the first set of photos shows a patient in her mid-40s. What were her issues and how did you plan her facelift?
Yeah, so this is a nice example of a female in her 40s, and she's got some early signs of aging around the eyes and also the neck and jawline. So if you look at her upper eyelids, there's some excess skin or hooding, and this caused the skin to overlap, and it made it difficult for her to apply makeup, and eyeshadow tend to cake in that area, and that's how she knew that it was time. And then she was also bothered by the skin laxity in her neck and jawline. It's pretty early in her case, but it bothered her because when she flexed her neck, she could see the bunching of skin. So in this case, I did a facelift to reposition the tissue in the face in a more vertical fashion and also tighten the skin. And that created a really crisp jawline.
Do you see many patients in their 40s who need a facelift?
Yeah, that's a great question. We think of facelift as a procedure of old age, but facial aging starts much sooner. It starts in the 40s and 50s. And in fact, I've seen a huge trend of women coming in their late 40s and early 50s to address these issues with a facelift because they're still working, they need to be competitive, they need to look young, and they want to do something before it's too late. And they want to have a really nice result. And the results are actually much nicer in a younger population when we start to see it in the late 40s and early 50s.
Okay, so we've got another set of photos here. A patient this time in her 50s. What were the main signs of aging in her? And is she typical of most 50-something patients? How did you perform her procedure?
Exactly. So as we get older, these signs are a little more advanced. So she had more advanced aging around the eyes. So to address that, I had to do an upper and lower blepharoplasty to address the skin around the eyes, but also I did a brow lift to improve the excess skin that was hanging over the upper eyelid that resulted from the forehead area. In addition, when you look at her neck and jowls, the jowls are much more pronounced, and this is pretty typical. So I specialize in what I would call a dual plane facelift. So in the deep plane, I'm repositioning the deeper tissue into a more vertical vector, and then I pull the skin in a natural, more youthful vector, which is different from the deeper tissue, and that creates a really beautiful, youthful result that looks natural.
All right, and this next patient here, we're moving, into the next decade. She's in her late 60s. What are the most important considerations in planning a facelift for somebody who might be getting older?
Again, these signs of facial aging have progressed and they're much more advanced. So I still have to address the eyes and the neck. Now, when I'm doing the lower facelift, I have to be much more aggressive in the neck. I'm removing more skin and I'm releasing more of that tissue so I can get a better vertical lift in the neck area. And it's much more difficult if you wait too long. In addition, I also did a CO2 laser treatment to her entire face And that really freshened up her look and minimized the fine wrinkles that are present.
All right, and now we have a male patient. He's in his 40s. What were his concerns?
Yeah, so with men, we also want to have a more defined neck and jawline. Now, with obviously we're able to hide it easier with a beard, but in men who don't want to grow facial hair, then they need to have a crisp jawline. And it can be a little more difficult because men have more structure, more volume in the neck. So it may require more advanced techniques to address other deeper tissues. For example, the deeper fat tissue, the submandibular salivary glands, and also the deeper muscles like the digastric glands. So these tissues have to be either repositioned or removed in order to get a more crisp, defined jawline.
Well, Dr. Doss, I'm sure we're talking about looks and we're talking about what's on the surface, but this can really affect your confidence. And so I'm sure all of these people have walked away more confident than when they walked in. Dr. Doss, thanks for being here. For more information on the natural look, facelift, or other procedures by Dr. Doss, you can go to dossmd.com and you can arrange a virtual evaluation right there on the website. Dr. Doss, thank you.
Thanks, Emily. Have a great day.